Welcome back to the course. In this module, you will learn the 5 characteristics high-reliability organizations use to reduce error and prevent harm. Let's dive in. At the core of the healthcare profession lies one critical commitment. First, do no harm. Yet, a 2016 study by Johns Hopkins reveals that medical error causes more than 250,000 deaths every year in America, making it the 3rd leading cause of death in the nation. The sobering truth is this: in a hospital, mistakes can cause irreparable harm to patients and their families. Fortunately, we can use mindsets pioneered in other high-risk industries to help us prevent patient harm and keep medical errors small. Hi, my name is Dr. Tessa Montgomery, and I'll be your guide during this course. In this module, we'll explore 5 mindsets of high-reliability organizing you can use to keep your patients safe. As we discussed in the last module, high-reliability organizations, or HROs, operate in high-risk sectors yet rarely, if ever, have catastrophic accidents. They readily adapt to unfamiliar, evolving situations to keep errors small and prevent harm. High-reliability organizing, or mindful organizing, as it's sometimes called, challenges the assumption that human error is unpreventable and patient harm is unavoidable. The truth is that other industries operate under high-stress conditions similar to those in a hospital, but they have far fewer fatal accidents. We can apply the strategies used in these organizations to make our hospitals safer. High-reliability organizations adopt mindsets and systems that help them prevent errors and skillfully respond to the unexpected. These mindsets and systems are summarized into 5 general characteristics: preoccupation with failure, reluctance to simplify, sensitivity to operations, commitment to resilience, and deference to expertise. These 5 characteristics make up the backbone of mindful organizing. If that sounds hard to remember, just think of the acronym FSOAR: failure, simplifications, operations, resilience, and expertise. Now, let's look at each characteristic individually. Most organizations are fixated on success. As a result, they tend to look for cues that validate their decisions, and they ignore warning signs until it's too late. High-reliability organizations do the opposite. They focus on all the ways a procedure or system can fail. They actively identify the mistakes they don't want to make, then take steps to prevent those mistakes from happening. They condition themselves to seek out and respond to subtle cues that something is wrong. People in high-reliability organizations don't rush to put a name on something unfamiliar or unexpected. They know that rushing to simplifications, like making comparisons or assigning labels, can blind them to subtle but important cues that help them make sense of an evolving situation. Instead, they cultivate nuance, they get comfortable with uncertainty, and they encourage different perspectives. People who practice mindful organizing focus on what the system is actually doing now, not what it's supposed to be doing or what they hope it's doing. This ability to separate expectation from reality allows them to anticipate, prevent, and mitigate errors. Managers and HROs stay in touch with workers on the front lines, and everyone in the organization asks insightful questions that focus attention on real-time operations. Even at their best, high-reliability organizations can't be prepared for every contingency, so they invest time and resources that help their people skillfully respond to unexpected crises. They promote cross-training to better equip their staff to manage an unforeseen event. When the unforeseen inevitably happens, they can learn while doing and learn by doing to remain agile and protect against harm. Managers in a high-reliability organization know that they don't know everything. When confronted with a new situation, they can identify people in their organization who have the skills and experience necessary to make sense of what's happening. They also recognize that expertise isn't limited to people with rank or seniority. For example, a new employee with experience running a telehealth clinic is a better expert on providing remote health services during a pandemic than a CEO with limited technical experience. Now it's time to apply what you've learned. Chantel is a pediatrician visually assessing a patient's newborn child. The infant has yellow skin, yellowing in the whites of the eyes, and dark urine. Chantel immediately suspects the child has jaundice, which would explain all of the symptoms she observed. Chantel can either order a course of treatment based on this diagnosis, or she can order a blood test to rule out other possible explanations for the infant's symptoms. What should she do? Click the answer you think is best. Chantel decided to discharge the infant without a blood test. What she didn't know, and what a blood test would have revealed, was that the case of jaundice was so severe that the child was in danger of developing brain damage from the high level of bilirubin in his bloodstream. The problem remained undiagnosed for more than a year. By that time, it was too late. The child would later develop cerebral palsy as a result of the misdiagnosis. In her eagerness to find a diagnosis, Chantel was quick to name what was causing the patient's symptoms and didn't seriously consider alternatives. Which of the 5 characteristics would have helped Chantel prevent this mistake? You're right. Being more reluctant to simplify would have sensitized Chantel to the dangers of diagnosing symptoms too quickly. Let's review some of the main practices in this characteristic. Click the Try Again button to see what happens if Chantel makes a different choice. Chantel didn't want to rush to a diagnosis, so she ordered a blood test on the infant. The results showed that the child had excessive bilirubin in his bloodstream, which would have caused cerebral palsy if left untreated. Because she caught the condition in time, she was able to treat it, which allowed the child to grow up healthy. Chantel recognized that immediately assigning a label to her patient's symptoms would have blinded her to other possible explanations. Which characteristic of high reliability organizing did she apply here? Correct. By being reluctant to simplify, Chantel protected her patient from harm.